the purpose of this roundtable is to kind of change gears a little bit. We've heard a lot from Daisy about the kind of the evidence base behind arts and health. We've heard from Debs about the impact of it. We've heard about the Finnish political context, but now we kind of want to step ahead and see if we can talk a little bit more practically about the political implications, the policy possibilities of arts and health, and how we might move this arts and health field into its next stage of life. And to do so, what I'd like to do is I'll be kind of having mini interviews with each of the roundtable members, but we'll also try to organically talk to each other. And I encourage all of you sitting here, if you feel like one of your colleagues is making a great point and you just want to kind of jump in and add something, please do that. We don't want to be too siloed. We want to be multidisciplinary and cross-sectoral and all those kinds of things. My first question, as I said, I'm going to ask of everybody. And I'll ask of you as well, Daisy. I think you at this point don't need an introduction anymore. But Daisy, can you tell us a little bit about why you started out on this field?
Well...
Oh, I think you might do, yeah.
Well, as you mentioned at the start, Nils, is this working? Yes. I was very lucky to have a kind of dual background in that when I did my PhD, I was working part-time and doing my PhD part-time. And my work was in hospitals in the UK where I was managing clinical innovations programs. And a lot of the programs that we were implementing were arts-based innovations. And the reason behind this was because we realised that the arts innovations were the ones that seemed to capture the attention and imagination of the healthcare professionals and the patients the most. So there seemed a ready appetite within these hospitals to be having these interventions. And so I worked very closely with the clinicians, discussing with them what challenges they were facing day to day in their work with their patients. And we looked at which of these challenges we could address with the arts. Now, of course, we couldn't solve everything, but it was remarkable how many of the problems we were able to address with arts-based innovations. And it became almost a challenge. How could we use the creativity of the arts, even for things where you couldn't see an initial link? Even things like how you could reduce the rates of did not attend patients in clinics by trying to use the arts as a better way of communicating and engaging with these patients. And alongside this, I was doing my PhD, as Nils said, in Psychobiology, so it was very quantitative. It was based in labs. I was doing lab work. I was doing lots of statistics. I was working on clinical trials. So it gave me this fantastic overlap between a real immersion in the arts and a real immersion in medical research. So that enabled me to think there was a way that we could be combining both of these. And my particular interest being in these kinds of medical methods, I started looking more and more at how we could apply biological studies and big data statistical studies in order to understand the arts better.
Taru, could you share with us why you think this is a particular interest or relevance to your life?
I have worked for state administration for a long time. Almost 30 years, and all the time I have been involved in promotion of well-being and health. So while in Finland promotion of well-being and health, it's very multi-professional, multisectoral, and we have always taken the approach not just healthcare but to work together with other sectors. And that's the background for me. It's part of my work career very strongly. And art wasn't so much included there, thinking about 20 years ago. It came later there, but of course it's somehow like a self-evident part of one of the sectors which is very important, one of the approaches which is very useful for promotion of well-being and health. And so that's the background. So it's difficult to describe any specific happening or anything behind that. It just built in the promotion of well-being and health. And somehow Finland has been very much promoting the approach of health in all policies already from 2006. So such a long time. It's and so it's built in the approach of this health, and nowadays we are speaking more about health and well-being in all policies. So that's the background why this is important for me. It's difficult to even think that art and culture not to be included in these activities.
That's very enlightened, I have to say. There probably not that many ministries that necessarily come from that same position. So I'm very glad to hear it, and obviously one of the reasons why we're here today. So we've kind of done the round here and talked a little bit about why art matters to us. And I think what comes through in most of the answers is that there's a kind of personal belief element here. There's a kind of personal conviction element. And I think that's a blessing, I think, because often it's what drives motivation, but it's also a bit of a curse, because we often find that the people who are most the most visible people behind these kind of interventions are people who have a personal reason for being there. And inevitably that leads us to this terrain where people perhaps criticize the arts and health for its anecdotal evidence as opposed to its kind of scientific evidence. And I guess one of the reasons why we've published this report is to push back about that. But can you tell us a little bit more about, as a researcher who's been deeply engaged in this topic for a while, what are the kind of, what do you see as the reasons for the skepticism, as it were, or why there might still be some skepticism? And this is also bearing in mind that there are some countries, I think in the Nordics perhaps, and also the UK, where the skepticism is perhaps on the wane. But there are definitely still many other countries in Europe and in the world where arts and health is not on the map and is still viewed quite skeptically. Why do you think that is?
I think there are a few reasons. I think, first of all, because this is such an interdisciplinary field, the research from this field gets published in such a wide range of journals, both medical, social science, and arts and humanities. So it genuinely is very difficult to piece all of that evidence together. And certainly writing this report, we had to dig very hard to get some of the studies because they were in places we weren't expecting. So I think that's been one of the issues, is people have been wondering, well, where is the evidence? And it's not been easy to find a really good synthesis of it. So that's what we've been hoping this report will provide, both a really good synthesis of the evidence, but also that hundreds of references for where people can go and look for further studies. I think a second reason has been that a lot of this evidence has started to accumulate over the last couple of decades, even though we've had anecdotal and written discussions of the arts for hundreds and thousands of years. So I think it's been quite difficult to separate some of the previous discussions that might have been slightly more myth-based or superstition-based from thousands of years ago from the actual rigorous evidence that's been happening for the last couple of decades. So I think that's been another issue. I think there are certain types of studies that we're still very much working on at the moment. So the clinical trials on arts and health have particularly been over the last 10, 15 years or so. Epidemiological evidence on arts and health has really been over the last few years. That's been driven, I know, predominantly by Nordic countries and particularly in the UK with my team over the last 2 years on UK data sets. So some of this stuff is very recent to be coming out. But I also think there's a third issue, which isn't necessarily a downside, but I think we need to value, which is that the arts are emotional and people do have personal stories to them. And the truth is that most people can't get that emotional about a hip replacement, hip surgery. It's not, I mean, it's obviously wonderful for the people who have it and the surgeons who do it, but it's not the most emotional of treatments, whereas arts interventions are very emotional. And therefore people get these very strong responses. They want to talk about it. They want to share anecdotes. And I think sometimes this is seen as a downside in terms of, oh, people are talking about anecdotes. Whereas what we really need to say is, yes, they're talking about anecdotes underpinned by robust research. Isn't it brilliant that we have both?
Several of you talked about the importance of health economics and how we still need research in that area. But you also, I think, talked a little bit about the importance of trying to understand arts and health at scale. What happens when you move from just one community program to something that gets rolled out across the entire country? And I was wondering if you could say a little bit about that. I know you're involved in a project that is trying to do exactly that in the UK.
Yes, so I think a lot of the clinical trials that we've had so far have had to be relatively small in scale or local. And I think something we've not had as much up is scale up of clinical trials. So if we liken this to drug studies, we've had a lot of phase 1 and early phase 2 clinical trials in arts, but we've not had the later phase 2 or phase 3 trials as much. So I'm working on a programme called Shaper, which is a new programme funded by the Wellcome Trust in the UK, which is joint between University College London, where I work, and King's College London, which is trying to do just that. It's trying to scale up interventions that already have good clinical evidence behind them, but take them up to the next level, involving more people as larger scale clinical trials. But there's also a second aim here, which is that lots of the studies that we do, they focus on outcomes. They don't necessarily focus on the implementation process. And this is key, because it's one thing to show efficacy and effectiveness, but if these trials aren't actually going, if these programs aren't actually going to fit within health services, they're not actually going to be able to work smoothly alongside the other treatments available, then they're not going to be delivered long term. So the other thing that we're doing with the Shaper project is to actually research the process of implementing and embedding these interventions within the health service in the UK. And this will help us with these specific interventions to understand how they work and how we can get them to work. But it'll also give us a blueprint for how other interventions that have got good initial evidence can be taken to that next stage and can be embedded, hopefully, long term within their health services.
Moving into the policy realm in the UK, I know there's quite a lot of activity. I mean, we have been talking a bit about the Nordic region here, and because I think there is quite a lot of policy interest, deeply held policy interest in the Nordic region. It seems to, arts and health seems to kind of gel very well with the Nordic mentality and the Nordic way of thinking. But there's also a huge amount of activity in the UK. You've mentioned some of the social prescribing work that's going on. Can you give us a kind of brief oversight about some of the things that are happening?
I think what we have in the UK particularly is an incredibly engaged and active grassroots arts sector. So we've got a phenomenal number of arts organisations, freelance arts practitioners who want to work in this space and who are actively developing and delivering programmes. And I think it's been really heartening over the last few years that we've seen increased buy-in from our arts councils into this, in supporting these kinds of programmes and in terms of integrating health and well-being within their strategies. Something we've been particularly trying to push over the last few years as well is the link between the arts and the health sector. And we've had an all-party parliamentary group on arts and health, which produced its own report about 2 years ago, and has been really trying to engage our politicians in this space and to try and support the linkages. And social prescribing is a great example that's come out of this very joined-up approach between the health sector and the arts sectors to try and support people to transition from primary care, from health, into engaging in arts programs. I think the challenge at the moment is that we're having a lot of political changes going on. So I think what we're trying to hope and move towards is a position where we have these long-term sustainable programs, and also hopefully the view that this topic is not political, but that it's something that is apolitical and should continue regardless of which government is in power, because it is recognised that the evidence is strong enough and that the benefits are clear enough.
So I know that you recently met with Bent Høie, the Norwegian Minister of Health and Care Services. And if you can, if it's not too top secret, can you share with us a little bit about, you know, how did you engage with him? What did you say? How did you? What was your impression of that meeting? And you know, did you manage to change minds? Did you have to change minds? How did that come about?
He is well aware that we are working on a commitment on that. But this last meeting you are referring to was that we have this national educational program in music-based caregiving for health and care workers. And this is crucial, and he is very aware that it's important for him that we adapt the cultural methods in the daily care workers. And that what we're talking about, how to implement arts and health, arts and culture in the daily care, so we could use these methods for the patient, and they are getting good of that. But he had one question. He was also concerned about more research that can document the positive demonstration, but also how to implement the arts, culture methods in the health field. And he want to have some more research how we implement, what is the barrier to implement it in the daily care. Yeah.
So maybe that would be a good moment to move back to you, Anna. As a healthcare commissioner, presumably you have some say in some of the funding that gets spent in relation to healthcare. How do you justify spending money on arts and health? I mean, you know, one of the questions that I was asked in the lead up to this panel by a reporter was, yeah, but isn't this just a kind of nice to have? You know, isn't arts and health, you know, at the end of the day, you want emergency services, you want kind of, you want your hospitals in place, you want to have those hip surgeons on the ready in case something happens. All this other stuff it's just a nice extra. I don't know if you ever get those questions, but how do you kind of answer that call, as it were?
Well, of course, you shouldn't choose between trauma care or cancer care and some nice music event. You need both. You need to be a whole human. You need to get all the medical treatments that are necessary for you. But you also need the cultural impact and the arts that also are necessary to you. And now we have some evidence. You've shown that today. So let's use that. Of course, the budget for culture in healthcare is very small, but it's also very important. And it's not very expensive. It's not the most expensive part of the healthcare, and it shouldn't be. But it should be a part of healthcare, not something you bring in if you have some extra money to spare or bring in if you have some extra time. This should be a part of the healthcare that's included. I think in every part of the healthcare system you need this.
Health equity, you mentioned that, is clearly one of those. I want to address that and maybe ask you again in a second, Daisy, if you could say a word or two about it. I want to address that in particular because I think there can often be this perception that arts is actually elite. You know, that those people who engage in arts and health interventions are people of a certain social status or with a certain type of background, and that in fact it is anything but equal. But I think the report has shown, and I think you can perhaps say a little bit about that from your experience and as a researcher and a practitioner, that in fact there's a tremendous opportunity here in terms of health equity.
So what we found is that, yes, there is a social gradient across certain types of arts participation. We tend to see this more for traditional high art activities like going to museums, galleries, or participating in things like learning musical instruments. And we see this more amongst adults. Interestingly, that the studies we've done on children, we've found that there is a gradient across participation outside of schools, but there doesn't seem to be in schools. And this is important because when we're having the question about why is it important to have arts in schools, one of the reasons it's important is that is a way of getting every single child. Whereas if we rely on children engaging in the arts outside of schools, that is inherently going to be driven by their parents' situations and their parents' past experience. But what's interesting is that, yes, there is a social gradient in participation, but there is no evidence that people of lower socioeconomic status benefit less from the arts. In fact, it seems to be the opposite. People who have got lower levels of socioeconomic status, or people who are living in poverty, or people who are living in more challenging situations, seem to benefit more from arts engagement. So this is very encouraging because it suggests that the arts can have benefits for everybody, but we just have to give people the access. And I think that's an important policy area for us all to think about, because it's something where there is an obvious opportunity to intervene and to try and make sure that people have got those access opportunities in childhood, but also across their lifespan, and particularly as they age too.
My last question, and this is to all of you before I pass over to the audience, is this question of multisectoral, interdisciplinarity, whatever you want to call it in different fields, different arenas. You know, it has different names. But the basic challenge is kind of what you were saying, Daisy, is that you're trying to bring together either commitments or evidence or people from a variety of places. You know, you were kind of saying in order for this to work, you kind of have to convince the ministries of health and welfare as well as the ministries of science and education or culture and research. And while the benefits of having everybody on board is, of course, you know, huge and can amplify the effects, it is still perhaps a higher threshold of you know, getting things started. I don't know if maybe we start with you. If you have some kind of insight into how you can get your colleagues from the other side to kind of just your colleagues to talk with you and be interested in this work.
Well, actually, we are talking already.
Okay.
We have a very good collaboration within the Secretariat
Yeah.
of the Nordic Council of Ministers, and there's an interest for this, but we cannot do it alone. We need the backup from our senior officials in all the 8 countries, and then, of course, the ministers, both sectors.
Does anybody else want to kind of briefly comment on this, just from the perspective of not necessarily where it works, because obviously if it works and, you know, multisectorality, if your colleagues are working with you, that's great, but where it doesn't work, where you found it difficult, and what you've done to or any tips and tricks, as it were, that you can give us to help engage with other sectors.
If I may continue.
Yes, please.
I think there needs to be an understanding on both sides why this is useful. Because of that, we need the data. We need to show that there's some benefit for the other sector to work with us, or vice versa. So that's something. People are so busy and have everyone own objectives and priorities. If you can't show that there's useful way to work together and have something in common, work together and reach some common objectives or common common problems. So that's something. And I think now we have, for example, on this area, evidence. And many countries have very good examples of experience on this area. So we don't always have evidence, but however, we have some experience which we could share. If other Nordic countries have good examples about what's working, so that's attractive for other sector or other countries to join together and try to take this approach forward.
Thank you.
Hi, my name is Stefan. I came all the way from Romania just to spend a few hours with you here for the launch of this report. Thank you for it. I think you did a wonderful job. And this panel is the best I've had in a long while, I think, so thank you for this as well. I'm the director of a Cluj Culture Center. This is an NGO that brings together 100 institutions and organizations from culture, academia, business, and the public administration in my city, which is the second largest in Romania. And we try to look at what sort of contribution can culture bring to society in terms of social transformation, well-being, and local development. And since this panel this conversation was so good, and it was a level that is absolutely sci-fi to most of the European countries, my question is, how do you connect? How can we connect this with what the European Commission is trying to do? Because I'm sure you know that in the new agenda for culture, well-being is among the 5 priorities, but is the least documented one, and it's not backed up by anything.
I'm looking at you, Taru. Maybe you want to say a couple of words about this, but I think it's such an important point. We kind of we're talking about the Nordic region. We talk about the UK, where a lot of the stuff is deeply embedded, where research is already active, where political commitments already exist. But this is one of these topics that is so translatable everywhere. How do we kind of make that leap?
Yes, that's a good question, and also a big challenge. I already mentioned what the WHO could do. For example, this issue and this report will be on the agenda next year in the regional committee. So the administrative body is deciding about the future activities of European regions, WHO activities. And that's something where all the countries have an opportunity to hear what has been done and what are the background documents, etc. So I think it's very useful for all member states to make their authorities aware of this so that they can support this activity in the administrative bodies, for example, regional committee. So that's WHO. And then EU, I mentioned earlier that Finland, just now being having a presidency, is taking forward the approach on economy of well-being. And that's something, there will be the council, there is the council conclusions already on this, just published 2 weeks ago, if I remember correctly. But it's just the beginning. There are the conclusions now, but it's just the basis for activities. We really hope that it will continue and all countries can have a support for implementation nationally, but also so that the Commission and the whole EU will take this approach forward, so that all sectors take health and well-being into account and not just economic aspects. So that's something, but it's just the beginning. But we are really hoping in Finland that it will be as successful as health in all policies, which was a previous priority theme of Finland in 2006. So, but we need the support from all countries and experts as well, so that we can in practice take this forward in EU. So a lot of to do, but we have good examples and good, I think there's a lot of support for this kind of thinking and approach. So having economic and well-being policies at the same level, and there, of course, should be one of the part also of a cultural aspect. EU has a lot of to do on that area as well.
Paula Karhunen from the Arts Promotion Center Finland. Now that we fully agree about the evidence and the impact of the arts on health, could one of the conclusions or maybe policy implications be the fact that we need a stronger arts sector in order to have the arts in the health sector? So I mean that to improve such things as professional arts education, employment conditions of artists and different support systems for artists, this would help the arts become more strongly in the health sector. And this is for Daisy Fancourt, this question.
I think Daisy was very quick to jump for the microphone, but I might also want to ask Anna that to comment on that question as well, perhaps.
Thank you very much. I couldn't agree more with what you say. I think the thing that always amazes and overwhelms me is how much, I guess speaking from a UK context, how much our arts sector manages to do with the funding that it has. I think it's absolutely phenomenal, the range of activities and the breadth and the sheer number that we have going on. But like you, I think I share a concern here around the investment in arts and cultural sectors. And I think my concern is that whenever there are times of austerity or funding problems, it seems like one of the first things to get cut is the arts and cultural sector. And I think that's because people think, well, it's non-essential, therefore let's cut it. And I think it often feels like saving €500 million or pounds in the arts is a quick saving. Whereas as a researcher, what I keep coming back to, even though we don't have the full evidence on this, what I keep coming back to is that saving €500 million or pounds or whatever, they're about the same at the moment, aren't they? Saving €500 million on the arts, I think, is ending up costing much more than that downstream for the health sector, because we then have lower levels of social cohesion, we have higher rates of mental illness, we have lower support available for individuals. So what I'd like us to get to is a point where funding for the arts and cultural sectors is somehow protected or ring-fenced and valued much better, so that we're actually investing more in this, making sure we're not just relying on the goodwill of artists to provide these activities for free or without enough funding, but we have a properly resourced sector that can genuinely meet the need that we have for it from a health perspective.